So our topic is on surrogacy for reproductive technologies. And this presentation is by myself, Jessica Espinoza, Mackenzie Hansen, Aileen Lee, and Christina Morales. Okay, so first and foremost, what is surrogacy? Surrogacy is a method of reproduction where parents work with the surrogate who will carry their babies until birth. Surrogacy is a great choice for those who cannot carry their own baby. Surrogates are implanted with fertilized eggs after fertility treatments such as in vitro fertilization called IVF.
So there are two types of surrogacy, traditional and gestational. Traditional surrogacy is where the surrogate uses her own eggs as part of the process, but this is still a means of caring for someone else. In this case, the surrogate or surrogate mother is the biological mother to the baby because she shares DNA with the baby. This type of surrogacy is not widely used and is illegal in some states. Gestational surrogacy is when the surrogate is impregnated with the intended parent's or donor's eggs and sperm using in vitro fertilization. A gestational surrogate does not share DNA with the baby she carries. This means that she will never be related to the baby, and she is solely carrying the baby for someone else. This type of surrogacy is not widely practiced in the United States, as it is, or this is the type of surrogacy that is practiced mostly in the United States, as it is the safer and legal options for parties involved. Next slide, please. Okay, so the advantages of traditional surrogacy are that it's less costly than gestational surrogacy. And if the intended parent is a woman, she does not need to undergo any medical procedures to get her eggs harvested. However, some disadvantages of traditional surrogacy are that there are a lot of legal implications due to the fact that the surrogate is a biological mother of the child. The surrogate has automatic parental rights over the child, and should she want to keep the baby, the intended parents would have to go to court to gain custody. The intended parents are also subject to step-parent adoption in order to be legally recognized as the child's legal parents. Many agencies do not offer traditional surrogacy, and in some countries and states, this type of surrogacy has been banned altogether.
All right, so what are the different types of in vitro fertilization? First and foremost, we have conventional IVF, where parents use their own egg and sperm, and the sperm is placed inside of the egg called the oocyte in a petri dish in a laboratory where fertilization occurs. Once fertilized, it is transplanted into the mother's uterus. There are several reasons that parents may choose to do this, and some reasons are early menopause due to cancer treatments, early onset of menopause due to genetics, naturally low ovarian reserve for unknown causes, being born without ovaries, poor egg quality to avoid passing on genetic disorders or diseases, or implanting previously frozen eggs. Sperm donations are often used due to infertility, untreatable STDs that can cause infertility, non-correctable problems such as with ejaculation, genetic or hereditary disease, or single women or those from the LGBTQI or A, which are choosing to use donation. Secondly, we have IVF, which is used with ICSI FET with PGD testing. And so what that means is that frozen embryo transfer, called FET, may be chosen in genetic testing of embryos for chromosomal abnormalities or gender selection is desired. Pre-implantation genetic diagnosis, PGD, is a genetic disorder or chromosomal screening of abnormalities in embryos. Women desiring to avoid birth control may safely freeze embryos, called cryopreserve, for later use and FET cycle. ICSI, in these cases, will assist fertilization by processing by using a tiny needle called a micropipette to inject the single sperm into the center of the egg. ICSI and FET can be done with or without PGD testing, as well as with donor eggs or with donor sperm. Next slide, please. So what are some benefits of IVF with PGD? Some advantages are that PGD biopsies the embryo and performs a genetic analysis, which includes the screening for a genetic variant of hereditary disease. Some of the risks are that it's timely, costly, no guarantee or promises, and can be somewhat an invasive procedure. Next slide.
So surrogacy allows couples and individuals from a variety of backgrounds, ages, and sexual orientations to build their families. Surrogacy is intended to be used for parents who may have struggled with infertility, like Jess said, mothers who are unable to carry a child, parents who have a genetic defect and health conditions that don't allow them to pass on to the child, and then couples in the LGBTQIA community who want to have a genetic link to their baby. So some pros for the intended parents. So it allows them to complete a family, genetic connections, creates relationships, fewer surprises, as in like diseases. It won't ever surprise them. They're allowed to be involved and likely to be successful. Some pros for the surrogate. So we have rewarding gift, experience pregnancy, sense of community, legally protected, and fairly compensated. Some cons, again, for the intended parents are that they may involve complications, whether it's medical procedures, surrogacy laws, and that it's costly and requires you to let go of some of the control. And then cons for the surrogate, it's physically demanding, emotionally challenging, and requires commitment for a significant time. Next slide, please. So some questions to address prior to surrogacy. This is more targeted for the agency itself. So again, they could be asked questions such as, what requirements do they need to meet in order to join their program? How do you ensure that potential surrogacies matches are safe for me to work with? What services do you provide to intended parents and surrogates? How do you match surrogates and intended parents? What kind of counseling do you have available? Do you offer most surrogacy support? What happens if something unexpected happens? How do you ensure legal protection? Can you break down the agency's costs and compensation for me? How many staff members do you have and how available will they be for us? How long have you been in business? And in that time, how many successful surrogacies have you completed? And why should I work with your surrogacy agency? Okay, and then there's a process to be completed for both the intended parents and the surrogate. The process consists of, again, committing to the decision, choosing the surrogacy type, finding a match, draft the contract, and complete childbearing processes. And then some questions that parents could ask the surrogates, they include, what type of things do you like to do? What are your interests? What are your values? What is important to you? What is your family like? And are they supportive of your surrogate plans? Have you been considering surrogacy for a while? What got you interested in adding to your family through surrogacy? Things to watch for when interviewing the parents. So questioning the necessity of legal contracts or an attorney's legal services, a focus on the financial aspects. So for example, intended parents asking to forgo contain services to save money, a sense of secrecy or unwillingness to talk about the surrogacy with their friends or family, a lack of support from either party's partner or family, and then rushing through the conversation, not asking any questions, or not seeming interested in getting to know the surrogate. Okay, and then these are questions that surrogates can ask the parents. So they can ask, how committed are you to surrogacy? When are you hoping to get started with the process? What kind of relationship would you like to have with me before, during, and after the baby's birth? How many embryos, um, how many embryo transfers will you attempt to achieve a pregnancy? How many embryos do you want to transfer at a time? Are you using your own sperm or eggs or donors? Are you willing to get to know my partner and children throughout this process? What do you plan to tell your child about surrogacy when he or she is older? What do you plan to tell them about me? Does your family know about your surrogacy plans? Are they supportive? Do you have certain surrogacy legal or medical professionals in mind to complete this process? What are your thoughts on pregnancy termination and selective reduction? What will you ask of me during the pregnancy? How do you plan to be involved in this journey? And what are you most looking forward to about being a parent?
So learning how to become a surrogate and change lives, you need to ask yourself if you qualify to become a surrogate. So the criteria is as follows. You need to have a BMI of 31 or less, be between the ages of 21 and 41, have had at least one child who you are raising, and if receiving government assistance, must also have a source of income. And then 2 other criteria methods are non-smoker and free of medications for anxiety or depression for at least 1 year under doctor guidance. When you become a surrogate, you begin a life-changing journey. And not only does being a surrogate give you an incredible chance to bring love into someone's life, it allows you to earn compensation for carrying a pregnancy for parents who cannot. Our US-based surrogate agency is always looking for women with big hearts who want to learn how to become a surrogate and help others have one of life's most rewarding experiences. Next slide. So the legal overview of surrogacy in the United States. So if you're looking for a legal overview of surrogacy in the USA, the most surrogacy-friendly country in the world, you've come to the right place. Most of the 50 states that make up the United States do permit surrogacy. To understand surrogacy laws in the United States, it is important to understand the foundation of their legal system. So the USA has a 2-tier legal system, which includes federal law and state law. Surrogacy falls under family law, which is at the state level. This is why we have 50 different surrogacy laws in the United States. Each state is empowered to create its own surrogacy laws. People have traveled all over the world to find a surrogate in the US. In some other countries, surrogacy may not be legal for certain people, or it may be not allowed at all. So a foundation such as CSP is happy to match US surrogates with individuals and couples of all nationalities and sexual orientations, and help with the legal process to ensure that all babies born in the US are able to travel home to their home countries with their parents. It is important to keep in mind that in a surrogacy arrangement, it is important for both the parent and the surrogacy to have independent legal counsel.
Okay, now we're going to be going over the supporting principles of surrogacy. So the basic concepts of autonomy, beneficence, justice, and non-maleficence are primarily applied in the healthcare ethics. These principles I've just described provide nurses with tools and a new foundation for making ethical judgments. When dealing with the ethical challenges in nursing, it is critical to grasp the importance of ethical theories and how to apply them. Some healthcare professionals have specific duties to these patients. All the nurses should take into consideration the patient's best interest. Consequently, there may be a clash amongst commitment to the patients and those within the community. All the nurses' judgment or beliefs aren't always the right ones and won't always be in the best interest of the patient. So such ethical theories that I just explained provide an ordered collection of values that nurses can use to determine what is ethical and what is not for the patient's activity. Moving forward with the ethical theories, the beneficence principle refers to the healthcare provider's actions in improving the well-being of the patient that are under their hands. In the case of surrogacy, the patient is the surrogate mother who takes on the risks for a certain payment. The principle of non-maleficence refers to the medical professionals and nurses to do no harm during their time of care with the patient and then later do good. Surrogacy is a basic right according to the liberty argument and a part of the principles of autonomy whereby an individual is entitled to make informed judgments about their personal concerns according to investigations. The autonomy concept empowers intended couples and potential surrogate mothers to offer informed permission voluntarily, enhancing their commitment to their surrogate agreement responsibilities. The justice principle highlights the specific requirements of the patient in being fair, unfair, appropriate, or inappropriate in their care plan. In the numerous circumstances when a surrogate mother pursues justice in terms of payment or concerns with a contract, the healthcare professional or medical staff is encouraged to retain trustworthiness and empathy in addressing the problems in order to achieve justice. Now moving forward with the nursing values when it comes to surrogacy. Surrogacy tourism is vital to nursing practice and fertility treatment. The well-being of the patient and the unborn child must be promoted during the surrogacy procedure as per the nurse's professional duty. Regardless of whether the woman plans to give up or retain the child, nurses must support her goals for the procedure and provide appropriate care. In order to guarantee that nurses deliver the greatest care, it will be more convenient to carry out such tasks in a setting with clear regulations that one will lax ones. The American College of Obstetricians and Gynecologists and the American Society of Reproductive Medicine have produced recommendations for surrogacy for doctors and patients, but there are no equivalent standards for the nurses.
So for our faith integration, one well-known example is the biblical story of Sarah and Abraham. The closest biblical story we have to surrogacy is of Abraham and Sarah in Genesis chapter 16. The story is that Sarah wasn't able to bear children, so she gave her servant Hagar to Abraham. This was a common practice during the biblical times, since a childless woman was considered shameful. This story closely resembles what we call traditional surrogacy today, where the mother is impregnated with the sperm of a man, often one whose wife is incapable of producing eggs, usually by means of artificial insemination. The Bible does not forbid the practice outright, but it does bring up questions of if surrogacy itself is immoral or ethical. In Psalm 127, verse 3, we see that the children are a gift to couples and not everyone is blessed with them. God will not always give us exactly what we want. Just as he has blessed some people within the incredible wealth, he blesses some of us with the ability to have children. A question that arises is, could you possibly be going against God's plan for you by trying to have a child anyway? With all of this in mind, it's truly up to God and the couple about what is right for them. Above all, those who are in the process should consistently pray for wisdom. And this concludes our presentation on surrogacy.
Okay, let me stop the recording.